What is the role of case management in social work to support people experiencing homelessness?
Oh, actually, I think I already jumped into that question
A little bit.
previously by saying that, quite frankly, I think that management is properly done. There are a lot of people who do not understand and use case management the way it should be. But properly done as a way of helping to support people and making sure that they get the services and supports that they need so they don't fall through the cracks. It's preventative medicine that keeps a lot of people from falling into the kinds of intractable, long-term problematic situations that we have. So, absolutely, I think we need to embrace case management. Had a couple of different routes. Okay, so part of the root of case management came really out of hospitals looking to identify nurses who could, make sure that the treatment plans for people were taken care of and then they got discharged as quickly as possible. Case management in social work really came out of a more of a comprehensive understanding of what is the complex psychosocial, physical, behavioral needs that people have. What are the needs that people have in order to live successfully? And how do you identify the resources and then make sure that people get connected to the resources? And you may identify gaps, but then you address how can you best deal with the gaps that exist. We don't really, there are no courses in social work, even at least in my faculty and a lot of other faculties, that teach those essential case management skills. I think we need that.
Yeah, it's more of a do with instead of a do to or do for, right? And that's what we see most common in social work atmospheres is that misconstrued mentality that I need to do this for this person,
Yeah, no, no,
or
no. Yeah,
show them how to do it. That is something that's long term and can create
that's right.
success.
Or in some cases, it is you can't do it, we need to do it together. Okay, so I mean, I'm thinking of things like if you're trying to go through the hoops and barrels of getting some kind of disability benefits, you can't just point a person to the door of the disability office. You got to walk in with them. You've got to be able to sit down and say, okay, let's have this conversation with the person who is going to be adjudicating your application. So, too much of case management is consisted of figuring out what the problems are and then giving people a checklist of what they need to do, rather than walking with them to get it done. So, good social work is all about sticking with your client until you make sure your client is connected on to what they need, and then checking back in with them to make sure that it's all going well, and then checking back in later on to make sure it's still going well, and recognizing that life has ups and downs. So it may go well, and there may be a time when it won't go well, and you need some additional supports. Um, we're a long way from that. We're halfway caught between wanting to do for the common good and watching the American independence model, which doesn't work at all.